Across Tilenga's host communities, families are accessing transformative opportunities. Youth are gaining practical skills that lead to employment. Farmers are getting improved yields and stepping into profitable value chains. Local businesses are joining supply networks once considered beyond reach. Women are accessing programs that open new opportunities and strengthen their voices and well-being. Families are benefiting from improved infrastructure that makes access to essential services easier, faster, and more affordable. Communities are shaping decisions, ensuring development reflects their needs. This is progress you can see, feel, and live every day. It is real shared value, where communities do not simply live near development, but experience it in their lives. And it's about growing together and building a future rooted in sustainable development.
Are you a parent or guardian looking for a good and affordable school for your child? Look no further. Mandela Senior Secondary School Hoima is the answer. It is a boarding mixed senior secondary school offering arts and sciences. We have good science and computer laboratories, a fully stocked library, and registered with the Ministry of Education and Sports with a center number at an affordable fee structure for every parent. To register your child with Mandela SS in Hoima, call 0772 411 921 or 0771 850 217. Mandela SS Hoima, caring to achieve.
Uganda Cares is a result of an international decision that was made by AIDS Healthcare Foundation in 2002. But before I go talk about the decision, I need to say a little bit about AIDS Healthcare Foundation. It's a mouthful name. AIDS Healthcare Foundation, we abbreviate it as AHF. Now, this organization is based in US, headquartered at Los Angeles, and its vision is to achieve global control of HIV and AIDS. But alongside that, it also does advocacy. This organization, it does HIV service provision in collaboration with different institutions, including governments, bilateral organizations, civil society organizations, and other community-based organizations, especially here in Uganda. Uganda Cares began in the year 2002, and its beginning was at the time when the drugs for treating HIV were not available. And so the president of AHF decided that Uganda as a country can begin collaborating with civil society organization and NGO, which is HF, to provide care and treatment of HIV within a public health institution facility. And so in that year, 2002, with the Ministry of Health, a decision was taken that the first supported HIV clinic will be opened in Masaka Regional Referral Hospital. So Uganda Cares began like that, providing care and treatment in Masaka. With the time, it has expanded. Right now, it's operating in 73 health facilities, 35 districts in Uganda. As I mentioned, its beginning, it began working with the Ministry of Health, and that means that it's a collaboration. Uganda Care is a collaboration with the Ministry of Health. So most of our support as Uganda Cares, we are doing it within Ministry of Health facilities. And so this is a collaboration we are here to talk about. So that is care and treatment, but with the time, the organization also expanded to prevention. Prevention, we know that it's better than cure. So in the year 2008, Uganda Cares began testing services. And we know that once somebody tests for HIV, then can prevent new infection and can prevent passing on a new infection to other members of the community, friends, and what have you. So we began a prevention program, as I said, in 2008. And later on, we added condom promotion, because you know that condom is one of the ways we can prevent transmission of HIV. So prevention is another activity that we are involved in. But alongside that, we also began engaging in advocacy to ensure that more services are accessed to people that need HIV services. Uganda as a country, we began in the year 2001 to seriously begin to look at the issue of HIV. Actually, the name Uganda Cares came as a result of the theme of the World AIDS Day in 2001. It was about, do you care about HIV? And so the response at that commemoration of the International AIDS Day was that Uganda cares about the issue of HIV. And we have seen Uganda coming out to ensure that no more HIV infection takes place. And at that time, 2001, 2002, there was a lot of emphasis on abstinence, as you know, being faithful, using the condom. And so these are the areas that Ugandans have taken on to ensure that we prevent a new HIV infection. The International Condom Day is a creation, is an idea, is an initiative by AIDS Healthcare Foundation. The day was established in 2009 by AHF, and the objective was to raise awareness about the presence of STIs, that includes HIV. HF recognized that on Valentine's Day, one of the exchanges will be romantic feelings, romantic exercises. And so strategically, HFs decided that we should have the International Condom Day on the 13th, on the eve of the Valentine's Day. As an organization that is all the time looking at where do we have a need in terms of HIV prevention, where do we have cases of HIV. So we have decided to commemorate the International Condom Day in Fort Portal City. And from the statistics that we have, this is a city where we are experiencing more HIV infection. The recent statistics report indicated that HIV prevalence is over 10%, and we know that the national average is 5. It has gone down to below 5. So that means that that's an area of need. And so we want to say that the condom still presents a good prevention measure against reducing the 10% prevalence in this city.
Good evening, everyone. I'm Haruna Semwemba, and I'm Prevention Program Manager for AHF Uganda Cares. AHF Uganda Cares is one of the global non-government organizations that is basically providing a cutting-edge advocacy medicine regardless to pay to around 2.8 million people worldwide, and we are situated in different countries where Africa is among the continents. In Uganda, we are basically almost in Uganda, where we have different facilities, almost 70 facilities in all regions: the northern region, southern region, western region, central region, eastern region. So that is where we operate in terms of provision of HIV services, in regards to advocacy, in regards to care and treatment, and prevention, which is now the main core where we bring in the condom use. There are very many preventive measures, but what we found the simplest, where you don't need a lot of technology, where you don't need a lot of approvals from a health worker, at a very low cost is the tool which we call the condom. A condom is one of the cheapest tools that is readily available, and we think if we increase the sensitization, we create awareness about the condom, we increase the access, availability, we shall be able to end or reduce the new transmissions of HIV by 2030. So I urge most of the people that if you think that you're in a risky behavior, in a risk type of a job, it's better to use, not to forget, a condom, because on this International Day, which is celebrated in Fort Portal, we are moving with a theme which we call Protection Still Works. We have collaborated with the Ministry of Health in collaboration with the other stakeholders, the Toro Kingdom, to commemorate this International Condom Day in Fort Portal, because we think this is it's a city, and most of the cities in Uganda almost have the same prevalence of HIV, and we thought Toro or Fort Portal is one of the cities that we think have a high prevalence rate, around 14% when we look at the previous statistics.
Dr. Kawoya Sulaiman is my name, and I serve AHF Uganda Cares as the Regional Medical Director, Central Region. Today is an important day where we gather to celebrate and commemorate the importance of a protective tool, which has been the condom. The condom continues to be a tool that protects people from acquiring infections like sexually transmitted infections, HIV, and also protecting or preventing those that don't want to become pregnant. So it is a tool that has been trusted for a number of years, and it is the protection that still works. And if it is used correctly and consistently, it is one of the proven tools that works.
The Lens program on UBC TV is proudly brought to you by.
Across Tilenga's host communities, families are accessing transformative opportunities. Youth are gaining practical skills that lead to employment. Farmers are getting improved yields and stepping into profitable value chains. Local businesses are joining supply networks once considered beyond reach. Women are accessing programs that open new opportunities and strengthen their voices and well-being. Families are benefiting from improved infrastructure that makes access to essential services easier, faster, and more affordable. Communities are shaping decisions, ensuring development reflects their needs. This is progress you can see, feel, and live every day. It is real shared value, where communities do not simply live near development, but experience it in their lives. And it's about growing together and building a future rooted in sustainable development.
Are you a parent or guardian looking for a good and affordable school for your child? Look no further. Mandela Senior Secondary School, Hoima, is the answer. It is a boarding mixed senior secondary school offering arts and sciences. We have good science and computer laboratories, a fully stocked library, and registered with the Ministry of Education and Sports with a center number at an affordable fee structure for every parent. To register your child with Mandela SS in Hoima, call 0772 411 921 or 0771 850 217. Mandela SS Hoima, caring to achieve.
The Lens program on UBC TV.
Dr. Wilson Kazora, working with Uganda Cares, AHF Uganda Cares as a quality improvement manager. And as we stand here today, I just wanted to mention one of the biggest national statistics we all know today is that the HIV prevalence in the country is on an average of about 5.5%, which means that if you select randomly about 100 Ugandans from across the country, HIV, you'd get about 6 out of 100 of those being HIV positive. But when you come to Fort Portal City, it's a bit different. The current national prevalence of HIV, in Fort Portal City is estimated to be about 14 to 14.5% according to the Ministry of Health data that we have. And so I wanted to talk about briefly what has AHF done in Fort Portal. Now, AHF, since last year, 2025, entered a partnership with the Ministry of Health and particularly Fort Portal Regional Referral Hospital, where we work under a memorandum of understanding, and we are strategic partners in both HIV prevention, care, but also treatment. And in the area, and I want to speak just briefly about HIV prevention. What have we done in the area of HIV prevention? And of course, our partnerships are usually very strategic, but also comprehensive, where we support the chronic care clinic at Fort Portal Regional Referral Hospital with healthcare workers. And is particularly in Fort Portal Regional Referral Hospital, we have 3 workers that are fully paid by AHF Uganda Cares to support that facility in managing clients on a day-to-day basis. And I believe this is a very, very significant contribution. But also in addition to that, we run an annual budget which is broken down into what we call a work plan, where we support HIV prevention activities. And these include HIV testing. And so when you come to Fort Portal Regional Referral Hospital, through our partnership, you'll be able to access free HIV counseling and testing. And this is one of the activities that we largely fund as an organization, again in partnership with the ministry and other partners that are supporting Fort Portal Regional Referral Hospital. So HIV testing, free of charge. We also provide what we call buffer HIV test kits in case our national stock is actually depleted. And then in addition to that, on an annual basis, we have a budget to procure condoms for Fort Portal Regional Referral Hospital. When we came for this event, I want to say that as we speak now, we've so far distributed for this event alone about 6,000 pieces of condoms. And that is a significant contribution, you know, towards HIV prevention efforts, especially as we commemorate the International Condom Day. And I want to say that as a hospital on a monthly basis, they request from our national program condoms on a monthly basis, and based on the targets that we have actually given to them. And so this is another very significant stride and effort that has been put in this city to ensure that we cap down on the HIV prevalence and also cutting down largely the new infections. But in addition to that, AHF in this place also supports what we call the care and treatment program, because as we all know, one of the backbones of HIV prevention is actually treatment. It is getting those who are HIV positive, of which we know that quite a certain number does not know their HIV status, and we test them, and if they are tested to be positive, the next step is actually to link them to care, and what we usually call lifelong care. And so we support this program, and we have above 7,000 clients who are actively receiving treatment at Fort Portal Regional Referral Hospital. And we know that as these are supported to continue daily, both at facility level but also in the community, to keep receiving their treatment, we are strengthening the backbone of HIV prevention, because we know whoever is taking well their medicines and they are suppressed, we know there's a common slogan that came from one of the recent international AIDS conference or society deliberations after a long-term research, that U is equal to U, which means that an undetectable viral load is equal to an untransmissible virus. So when patients are kept well on their medication and they're taking it well and their viral load is suppressed, or what we call undetected, such an individual cannot transmit HIV to another person. And then the last approach that we also believe is very significant is the Young People's Program that we are actually running in Fort Portal. And this Young People's Program, you know, focuses on those who are HIV negative young people who AHF is directly working with, but also supporting in various ways, including, keeping them in school, but also skilling them to empower them, because one of the largest drivers of HIV is actually poverty. So as we skill them and empower them, we are not only, helping them deal with their other financial burdens, but we believe we are also helping them, not contract HIV. And so these young people are also trained to become advocates, to fellow youths or young people who are HIV negative to actually stay HIV negative. They are also empowered with sexual and health education, and they go into the communities, conduct dialogues with fellow young people, and through this, we are cascading sexual and reproductive health information that is crucial to curbing down the increasing the numbers of those who are acquiring HIV.
We've had a number of engagement with different stakeholders, including the youth, leaders from different institutions. Last year, on World AIDS Day, one of the key activities that we did in Toro region was to engage young people, and the question was, why? Why are we still experiencing high HIV prevalence rate in this region and for Porto City? These are youth that responded, and they gave us the following factors. One of the factors the youth highlighted was the parenting. The parents are no longer caring about their children. They are not giving them time. They are not guiding them. They are not bothered where they have gone. They don't want to know who is their friend. So the youth have decided to do what they want, and which has predisposed them to infections like HIV. The other reason they gave us, the other factor, they told us about poverty. Personally, I don't believe in it. But for the youth today, they are saying poverty. If the parents cannot provide a smartphone, they will look for it by all means. And we are seeing, because of looking for things that they cannot get, they are engaging in sex with the older men and the young boys with older women.
Today we commemorated the World Condoms Day, and the intention was to create awareness on the effective use of condoms. As you know, as a city, we are ranked high in the prevalence rate, which is very unfortunate. So it was very prudent for us as a city to partake into the celebration or the commemoration of World Condoms Day.
I am Nicholas Mugume, the Minister in charge of Youth Affairs, Toro Kingdom. Today we are gathered here at the commemoration of the International Condoms Day celebrations here at Mucho Grounds. And specifically why we've hosted this event is to leverage and on our other engagements we've had over time to ensure that we fight the HIV scourge that has affected our people within Toro, especially in Porto City. So as a kingdom, we've placed several measures, and part of the measures is we have leveraged on our activities to ensure that we do massive sensitization on and awareness on people testing to know their status. We believe as a kingdom that you cannot fight what you don't know. So we've taken time using our platforms like the Toro Kingdom Masaza Cup, whereby in every county that we happen to have these games of the Masaza, we ensure that there is a health facility testing our people. And we know, leveraging on these standards that we've placed as a kingdom, our people have been in a position to know their status, so that those that find themselves safe can safeguard themselves the more, and those that happen to find that they are sick in any way are advised to ensure that they take appropriate medication.
I'm Rosemary Narada, Advocacy and Communications of an NGO called WONETHA. WONETHA is a women organization network for human rights advocacy. It is an NGO that cares female sex workers in Uganda. As of now, we have so far conquered 18 districts in Uganda caring female sex workers. Under the issue of HIV, unwanted pregnancies and STIs, plus other skills in female sex workers. Today, we are here at Mutual Grounds, Fort Portal City, celebrating an International Day of Condom. We are here to call upon all Ugandans, and I call upon all female sex workers to smartly use condoms. Always request for a condom wherever you are. Just use a condom because it is the best preventive measure to prevent yourself from HIV. I call upon all Ugandan women to always use a condom. A condom is the best way to prevent yourself from unwanted pregnancies, STIs, plus HIV.
My name is Babas Martha Atai. I work with AHF where I coordinate advocacy activities. First of all, I would like to let the whole world know that this International Condom Day was an innovation by AIDS Healthcare Foundation way back in 2009 with an intention to create awareness about the benefits of using a condom and emphasizing safer sex behaviors. And today we join the rest of the world to commemorate this day and bring information and messages that will help people to appreciate the use of a condom and as one triple prevention tool that will enable us avoid infections like HIV, STIs, and unwanted pregnancies. And from the skits that we've seen from the young people supported by AHF Uganda Cares in Fort Portal here, we've seen that there is need, there are behaviors that predispose young people, and therefore we want to challenge parents to support their children. Communicate with children so that they get to know what is good to do and what is not good to do. They need to be able to work with other structures to support the young people to grow without getting exposed to HIV. So as an organization, we worked together with the Kingdom of Toro and in partnership with Ministry of Health and other stakeholders to bring this program today in Fort Portal City. And we are happy that we've been able to distribute close to 68,000 condoms. We have also brought condom dispensers. We brought 30 condom dispensers, which we are going to install this evening in different hotspots and ensure that the last mile distribution of condoms is achieved just in line with the government program as a priority.
The Lens program on UBC TV